Pancreatitis is a serious and painful condition that happens when the pancreas becomes inflamed. The pancreas is a long, flat gland that sits behind your stomach in the upper abdomen. It has two main jobs. It produces digestive enzymes that break down fats, proteins, and carbs in your small intestine, and it releases hormones like insulin to regulate blood sugar. So think of it as a hidden hero in your body. However, when the pancreas becomes inflamed, these digestive enzymes become activated while still inside the pancreas, essentially causing the organ to begin digesting itself. This leads to severe pain, swelling, and potentially life-threatening complications. Types of pancreatitis. There are two main types of pancreatitis: acute and chronic. Number 1. Acute pancreatitis. This is the sudden, short-term inflammation of the pancreas. Most cases are mild and resolve within a week with proper care, but about 20% become severe, leading to complications like pancreatic necrosis, death of pancreatic tissue, or systemic organ failure. In the United States, acute pancreatitis leads to approximately 275,000 hospitalizations annually, making it one of the most common gastrointestinal causes for hospital admission. The incidence of acute pancreatitis ranges from 13 to 45 cases per 100,000 people each year in different countries. Number 2. Chronic pancreatitis. This is a long-term condition where the pancreas remains inflamed over many years, leading to permanent damage. This happens because scar tissue replaces healthy tissue, impairing the ability of pancreas to function. Chronic pancreatitis is less common than the acute type, with an annual incidence of roughly 5 to 12 cases per 100,000 people. The condition is more prevalent in men than women, particularly in cases related to alcohol consumption. Symptoms of pancreatitis. The symptoms of pancreatitis can be quite intense and vary depending on whether you're dealing with acute or chronic forms. In acute pancreatitis, the hallmark symptom is severe upper abdominal pain that often radiates to your back. This pain typically comes on suddenly and can be excruciating. Many people describe it as a constant drilling sensation that gets worse after eating. You might find yourself hunching forward to try to relieve the discomfort. Nausea and vomiting frequently accompany the pain, making it difficult to keep any food or drink down. Your abdomen might become swollen and tender to the touch, and you might develop a fever. Some people experience rapid heart rate and breathing difficulties, especially in severe cases. In chronic pancreatitis, the symptoms can be more subtle at first, but build over time. The pain might come and go, but generally persists, and you might notice you're losing weight without trying because your body isn't absorbing nutrients properly. Digestive problems become common. You might notice oily, smelly stools that float, a condition called steatorrhea, which happens because your pancreas isn't producing enough enzymes to digest fat properly. Over time, chronic pancreatitis can lead to diabetes as the pancreas loses its ability to produce insulin. Causes of pancreatitis. Understanding what triggers pancreatitis is crucial for both prevention and treatment. The most common cause is gallstones. These small, hard deposits in your gallbladder can block the pancreatic duct, forcing enzymes to back up into the pancreas instead of flowing normally. While gallstones often trigger acute attacks, heavy alcohol use is another major concern that can damage the pancreas over time, potentially leading to both the acute episodes and the chronic type. Your medication regimen could also play a role, as certain antibiotics, blood pressure medications, and cancer treatments have been known to affect the pancreas as a side effect. People with very high triglyceride levels in their blood, particularly above 1,000 milligrams per deciliter, face an increased risk of developing pancreatitis as well. Some individuals are simply more susceptible due to their genetic makeup, as certain inherited mutations can affect pancreatic function. Your own immune system might also be the culprit, as autoimmune conditions can cause it to mistakenly attack pancreatic tissue, resulting in inflammation. Even physical trauma, such as injuries from car accidents, can directly damage the pancreas and trigger acute pancreatitis. Various infections can play a role too, with viruses like mumps and certain enteroviruses known to cause pancreatic inflammation. What's interesting here that up to 15% of pancreatitis cases are idiopathic, meaning doctors can't pinpoint a clear cause. So sometimes it's just bad luck. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of pancreatitis. Diagnosing pancreatitis involves several steps and tests to confirm the condition and determine its severity. Your doctor will start with a thorough physical examination and detailed medical history, asking about your symptoms, alcohol use, medications, and any family history of pancreatic problems. Blood tests play a crucial role in diagnosis. They'll check for elevated levels of pancreatic enzymes, particularly amylase and lipase, which typically rise dramatically during acute pancreatitis. Your doctor will also order imaging tests to visualize your pancreas and surrounding structures. This might include an abdominal ultrasound to look for gallstones, a CT scan to assess the extent of inflammation and check for complications, or an MRI to get detailed images of your pancreatic and bile ducts. In some cases, doctors might use endoscopic ultrasound, where a thin tube with an ultrasound probe is passed through your mouth to get close-up images of your pancreas. Finally, your doctor might also perform tests to check your kidney and liver function, as pancreatitis can affect multiple organ systems. Treatment for pancreatitis. Treating pancreatitis depends on its type and severity. The goals are to manage pain, address the underlying cause, and prevent complications. So, here are the available treatment options. Number 1. Hospitalization and supportive care. The first step in treating acute pancreatitis usually involves hospitalization for close monitoring and supportive care. You'll receive intravenous fluids to prevent dehydration and maintain proper blood volume. Pain management is crucial, and you'll typically receive strong pain medications like acetaminophen or opioids through an IV. Initially, you'll need to stop eating and drinking to give your pancreas a chance to rest and recover. This fasting period typically lasts a few days, after which you'll gradually return to eating, starting with clear liquids and progressing to solid foods as tolerated. Number 2. Nutritional support. For severe cases or prolonged periods when you can't eat, nutrition becomes a critical concern. Your healthcare team might insert a feeding tube through your nose into your intestine, which is called nasogeginal feeding, or provide nutrition through an IV, which is called total parenteral nutrition. This ensures your body receives the necessary nutrients while still allowing your pancreas to rest. Once you can eat again, you'll typically follow a low-fat diet to reduce stress on your pancreas. Number 3. Treatment of underlying causes. Addressing the root cause of pancreatitis is essential for effective treatment. If gallstones triggered the pancreatitis, you might need an ERCP, or endoscopic retrograde cholangiopancreatography. This procedure uses a flexible tube with a camera to locate and remove stones, blocking the pancreatic or bile ducts. If high triglycerides are the culprit, you'll need medications and lifestyle changes to lower them. For alcohol-induced pancreatitis, you must stop drinking completely, and you might need support for alcohol dependency. Number 4. Surgery. Surgery might be necessary in severe cases or for chronic pancreatitis that doesn't respond to other treatments. This could include procedures to drain pancreatic pseudocysts, remove damaged portions of the pancreas, or repair ducts. In some cases, total removal of the pancreas might be necessary, though this is typically a last resort. Number 5. Lifestyle modifications. If you've had pancreatitis, it's crucial to avoid alcohol completely. A low-fat, high-protein diet with small, frequent meals can also help manage symptoms. Finally, if you have any severe abdominal pain, especially if accompanied by nausea and vomiting, you should seek immediate medical attention. Don't try to tough it out. Early treatment can prevent serious complications. While it can be scary to deal with pancreatitis, with proper care and lifestyle modifications, many people with pancreatitis can maintain a good quality of life and prevent future episodes. Now, we want to hear from you. Have you or someone you know ever experienced pancreatitis? What was the experience like, and what treatments helped the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.